Hi everyone, I think now I'm live and yes, please. I think now I'm live. So now I think I'm live. Good afternoon, good afternoon. How are you all doing? How are you all doing? I hope you all are doing good. So students, some confusion was there. That is why my other session got live. So now let's start this part. So here you know that what are we going to do? We are going to discuss the disorders, right? All the disorders which are given in your class 11th and the 12th biology. We'll be discussing it today. Okay. And basically we will discuss them today and we are going to revise them. Ready? Yes, everybody, ready? So from this part, for sure, on the basis of disorder, at least 3 to 4 questions, minimum 3 to 4 questions will come. Minimum, I'm saying, right? It can be 5 as well. It can be 6 as well. Okay. Okay, so make sure you attend this session till the end. So let's start the disorders of the respiratory system. Here I will stick to the NCERT. Mainly they ask the disorders from the NCERT only. So first is asthma. So asthma is the difficulty in breathing, right? When somebody is not able to breathe properly and there is a kind of wheezing sound, and it is, why is it occurring? Due to the inflammation of bronchi and bronchioles. So it is from this part the question can come, and this is a PYQ as well. So it is the inflammation of bronchi and bronchioles. What is it? It is the inflammation of bronchi and bronchioles. Then comes the emphysema. So when you talk about the emphysema, it's a chronic disorder, and those who are chain smoker, those who smoke every day, those who smoke every day, they usually they are highly affected with this particular disease, that is emphysema. So what is it? It is emphysema. So it's a chronic disorder in which alveolar walls are damaged, right? So if alveolar walls, because alveoli is the primary site for the exchange of gases, yes or no? Alveoli is what? It is the primary site for the exchange of gases. Yes, please. For the exchange of gases. So of course, if alveolar walls are damaged, then indeed the respiratory surface will be decreased, the exchange of gases will be affected, and all the body organs, they will not get the sufficient oxygen. Are you getting my point? So that is why, right, all not just the lungs, all the other body disorders will, all the body organs will get affected here. So here it is mentioned that one of the major causes cigarette smoking. So this is what you have to underline. And alpha 1 antitrypsin, please write down, alpha 1 antitrypsin is used to treat emphysema. Right, this is the one which is used to treat emphysema. Basically, what is happening here in emphysema? Because you know that there is basically that alveolar walls, they will break. Okay, alveolar walls, they will break here. Are you getting my point? Right? Yes, please. Are you getting my point? Yes, students, are you getting my point? So this is how it works. So alpha 1 antitrypsin is used to treat this, right? So it is basically made in the liver, right? This alpha 1 antitrypsin, it is, where will it make in our body? It will make in our liver. So it will prevent the activity of an enzyme, prevent activity of an enzyme called elastase. So anyone here who can explain me what is this? What is the function of this elastase? Yes. So it prevents the enzyme elastase activity, right? It is going to do what? It will prevent the activity of enzyme elastase. Is that clear? Yes. So beta, elastase actually released by the neutrophils which are there in the lungs, right? That neutrophils, they basically, actually that neutrophils basically make the elastase. So this elastase, because they will, this is actually the one which will prevent the, which will inhibit rather or break the, which will basically break that elastic tissue in the lungs. So if its activity will be stopped, right, then the elasticity in the lungs will be there, and what will happen? The exchange of gases, right? The exchange of gases will occur properly. So alpha-1 antitrypsin is used to treat this particular disease. Is that clear? Yes, please. So the next is the occupational respiratory disorder. Basically, as the word is saying, it is related to the occupation. Like some people, they work in the coal mines, they work in the stone industries. So though they use the precautions there, they use the mask there, but it is not always helpful, right? So they basically inhale the pollutants, and that can result in the disorder that can affect the lungs. Actually, what is happening? See, if in the lungs, these pollutants will be too much in the lungs, then what will happen? Basically in the lungs, what will happen because of that? In the lungs, because as the protective mechanism of the body, right, the proliferation will occur, the fibrous tissue will be more. Right? If there will be more fibrous tissue in the lungs, lungs will lose, automatically will lose their elasticity as well. So in one way or another way, this is how it basically affects the lung. Is that clear? So here you can see that especially those which are involved in grinding or the stone breaking, the dust is produced that the defense mechanism of the body cannot cope up with the situation. So long exposure to such kind of pollutant can give rise to the inflammation, right? So inflammation will be there, and fibrosis, that is proliferation of fibrous tissue, will occur. Are you getting my point? So serious lung damage will be there, though they bear all that precautions, these masks and all, but it is not always the helpful one. Is that clear? Is that clear? So let's move to the next part. So we will talk about the disorders of the circulatory system, but when it comes to the respiratory system, yes, this is what you need to know. Okay? Okay? Yes, please. So when it comes to the occupational respiratory disorders, occupational respiratory disorders, so what you people can see, जैसे we have the examples of asbestosis, silicosis. So the one who's going to inhale asbestos, they'll get affected with this. So ultimately the proliferation of the fibrous tissue will occur, right? So asbestos fiber, so this is those who are, you know, working in the construction industries, right? There, construction industries, etc., etc. So they'll get affected with this. So this is how it works. So it depends where that person is working, and accordingly the disorder can occur if precautions will not be taken. Now next is the, because here we are just sticking to the NCERT, so next is the high blood pressure, which is known as hypertension as well. So you know that normally it is what? It is 120/80, right? So 120 is what? Is it the systolic or diastolic? What is it? Basically, we are talking about the high blood pressure, hypertension. So basically, it is higher than the normal, right? So here 120 is also given, 80 is also given. So 120 is your systolic pressure, yes or no? Systolic pressure. And when you talk about this 80, it is the diastolic pressure. What's that? It is the diastolic pressure. So basically, one is what? One is because of the, in case of heart, these are the terms that we use, right? When you are saying systole, what are you actually talking about? You're talking about the contraction, right? And when we talk about the word diastole, then what are we talking? We are talking about the relaxation, yes or no? So one is contraction, another one is relaxation, right? One is contraction and the another one is what, beta? Another one is relaxation. So when you are talking about this 120 mmHg, right? This particular pressure, so millimeters of mercury pressure, it is the systolic pressure, as I said, which is basically for the contraction or the pumping pressure it is. And 80 is the diastolic pressure, which is the relaxing pressure or the resting pressure. So if repeated checks of blood pressure, like let's suppose if in an individual, if there is a problem in blood pressure, if it is fluctuating, it is not good. It's a sign that that person might get the heart issues. Okay, so if let's suppose it is 140/90 and sometimes even if it is over 140, and when it is the hypotension, then it can be lower than the normal value. So when the blood pressure is high, it can affect the other body organs as well. Okay, it can affect the other body organs as well, right? So heart diseases will be there, but the brain, the kidney, they all will be affected. So next is the coronary artery diseases, CAD. And we are also using the word atherosclerosis here. So I will ask you one question here. Atherosclerosis, and one is atriosclerosis. Do you know the difference in these two? Or do you think they both are same? Yes. What do you think? They both are same, or is there any difference in them? Yes, please. Yes, please. Anybody here? Anybody? Atherosclerosis and atherosclerosis, what are they? What are the differences here? Yes, please. Actually, if I have to tell you the difference here, right, yes, they both are not same. One is the type of another. So here, when you are talking about the atherosclerosis, so arteriosclerosis is considered as a general term, right? It is considered as a general term, right? And here, this one is actually a specific term. Are you getting my point? This one is a specific term, and this one is what? This one is the general term. So in the case of atherosclerosis, we will see that there is a fatty plaque deposition, right? There is a fatty plaque deposition, fatty plaque deposition, due to which there is the narrowing of artery. Are you getting my point? Due to which what will be there? There is the narrowing of artery, right? Right? Yes or no? And here, there is the hardening of, like here what we discuss in general, that there is the hardening of artery, and obviously due to which what will happen? If it will get hardened, the elasticity will not be there. Is that clear? Right? So there will be the loss of elasticity in it. In this case, what will happen? There will be the loss of elasticity. Is that clear? So this is what you have to understand. So atherosclerosis, we basically use for what? So basically it is a general term. Is that clear? It is a general term. So just have a look here. So in the NCERT, they basically talk about atherosclerosis. So it affects the vessel that supply the blood to the heart. We know that it is the coronary artery that will carry oxygenated blood to heart muscles. Yes or no? This is the one that will carry oxygenated blood to heart muscles, yes, heart walls, yes or no? Right? Or the heart muscles. So it is caused by, so this atherosclerosis, where ultimately what is happening, as I said, the lumen of the artery will get narrower. Why? Because the plaque will get deposited. So here you will see calcium, fat, cholesterol, and the fibrous tissues, they will get deposited. Understood? They will get deposited. They will get deposited, right? So it is actually, so from atherioma, that is the plaque. That's what you have to remember, okay? That's what you have to remember. And it basically occurs due to the high LDL. This one, this atherosclerosis, how will it occur? It will occur due to the high LDL, that is low density lipoprotein. Is that clear? That is the low density lipoprotein. So because of it, this will occur. Next is angina, chest pain, angina pectoris, right? Next is what? Next is angina pectoris, chest pain. Done? So it is also called angina pectoris, a symptom of acute chest pain. So why it will occur, right? Because there will be no sufficient oxygen is reaching to the heart muscle. Heart muscle is not getting the sufficient oxygen. That's why this is occurring, right? So obviously, multiple reasons can be there. If let's suppose, even if you are talking about the narrowing of artery, right, the blood flow will be restricted, and then also it can result in this. So angina can occur in men and women of any age, but it is more common in the middle-aged and the elderly people, right, students? So it is occurs due to the condition that affect the blood flow. So anything which is restricting the blood flow can result in angina pectoris. Next is the heart failure. What is the role of heart? To pump the blood. So if heart is not able to do its job, matlab it's a failure. That's how I remember. Means when heart, it fails to pump the blood, then it is the heart failure. So heart failure means state of heart when it is not pumping blood effectively enough to meet the needs of the body. Okay, so how can this occur? Like if you are not doing your job well, if you are not able to qualify, if you are getting failed, there might be the destruction. So in that case, what will be the destruction? It is related to the lungs. So it is sometimes called congestive heart failure, right? So if there is the congestion of the lungs, right, then obviously this thing will also occur. That's how it is connected. But the cardiac arrest is a different term, because when we are saying cardiac arrest, heart stops beating. Right, you are arresting heart. You're like, whatever you are doing, don't do it. Stop it. So heart will stop beating. And when it is the heart attack, which is also the myocardial infarction, then it is when the heart muscle is suddenly damaged by inadequate, that is insufficient blood supply. So all the terms are important here. Next is the disorders of the excretory system. The very first is uremia. So when excess of urea in the blood, you know that urea is, we are the ureotelic organisms, right? Basically we excrete out urea. So if urea is not getting out, it is getting accumulated in the blood. It's a sign our kidneys are not functioning well. So uremia means accumulation of urea in blood, which is highly harmful and obviously can result in the kidney failure. Is that clear? Can result in the kidney failure. So next is what? In such patient where kidney is not working, what will be done? Hemodialysis, which is also the artificial kidney, which is a kind of, which is a blessing for these kidney patients. Right, hemodialysis, artificial kidney. So beta, here also the basic principle is of this diffusion itself. Just say what will happen, the blood from a convenient artery, so you can see that during this process the blood will be drained from a convenient artery, right? It has to pump in a dialyzing unit, which is basically the artificial kidney. So basically I'll make few things clear. Like let's suppose if you are taking out the blood from the body, of course firstly we have to add heparin like compound, right? Heparin like compound, which will not allow it to get coagulated, because in our body naturally we have the heparin, which is the anti-blood coagulant, which will not allow our body to get clotted, right? So we have to add first of all we blood will be taken out, this compound will be added, so you will pass it from a dialyzing fluid. So there will be the tubes. Actually these tubes are what? Just cellophane tubes are used. They are semi-permeable in nature, right? And in their surrounding, what will you see? You will see a dialyzing fluid, as I said. What will you see? You will see a dialyzing fluid. So when the blood will pass through it, this dialyzing fluid is having the same concentration just like plasma, right? It is having same concentration just like plasma, but it doesn't contain nitrogenous waste, right? It is having same composition just like plasma, but it doesn't contain what? Nitrogenous waste. So when the blood will flow in these tubes, right? Obviously here in this blood, the nitrogenous waste will be there, but in the surrounding dialyzing fluid, it is not there. So obviously it will pass there. This is the diffusion. Yes or no? It will pass to the surrounding, to this fluid, right? So in this way, the blood will be filtered out, and then later with the help of, right, this filtered blood, with the help of a convenient vein, after adding anti-heparin, right, it will be passed back to the body. So no doubt, it's not a very easy task, right? It is not a very easy task, or I won't say that financially it is very, easy to bear the finances as well. No, this is not the thing here. But again, this is still a blessing for the kidney patients, okay? Okay, so let's see this. So during the process of hemodialysis, what exactly is happening? Blood is drained from the convenient artery. It is pumped into the, please read it carefully, it is pumped into that dialyzing fluid. Is that clear? Is that a dialyzing unit, right? So blood will be drained, it will pumped into that dialyzing unit after the addition of an anticoagulant like compound. Is that clear? Done, beta? Done? So it is a diffusion, osmosis, ultrafiltration on the basis of that we discuss this. So this unit will have, this dialyzing unit is having coiled cellophane tube. Cellophane, you know that, right? Cellophane, you know that it is semi-permeable. Is that clear? It is basically semi-permeable. So this artificial kidney is also referred to as dialyzer. Okay, it is also referred to as dialyzer. Is that clear? Is that clear? And here, as I told you, this is the semi-permeable in nature. Any doubts? It is semi-permeable in nature. Okay, so this fluid is having the same, composition as that of plasma. It's just that in this fluid, nitrogenous wastes are not there. So from this porous cellophane membrane of the tube, the molecules will pass as per the concentration gradient. So dialyzing fluid is not having the nitrogenous waste, so they can freely move out, clearing the blood. So cleared blood is pumped back through the vein after adding antiheparin. So any doubt here? Any doubt here? Any doubt here? Yes, please. Sure. So this procedure takes around 3 to 5 hours, and it has to be done 2 to 3 times a week. 2 to 3 times a week for 3 to 5 hours. Right? So next is the renal failure, when kidneys, they are not at all functional. In that case, the transplantation is preferred. Okay, what is preferred? Transplantation. Then comes the renal calculi. So renal calculi means you are talking about the kidney stone. So stone or insoluble mass of crystallized salts, right, oxalates, etc., when they are formed, yes please, when they are formed in the kidney. So this is the renal calculi, that is the kidney stones. Here you are talking about what? You're talking about the kidney stones. Any doubt? So the common term is the kidney stones. So it is technically, you call it as renal calculi. Is that clear? So they are the crystallized stones. Okay. So it is also referred to as urolithiasis, even nephrolithiasis. These are the another names. So make sure you mark it in your NCERT. Yes, please. Done? So calcium oxalate stones are the most common one. So when we take low water, when our diet is having low water, when we take low water, and moreover when we are having high calcium in our diet, plus we are having urinary infection, plus there is high uric acid in the body, all that things can cause it. So calcium oxalate salts are the most common one. Otherwise, other salts are also there, but which one is the most common? Which one is the most common? It is the calcium or oxalate, right? Calcium oxalate stones. So calcium phosphate, uric acid stones, anything can be there. Done? So next is glomerulonephritis. It is the inflammation of glomeruli of kidney. So it can occur due to any infection also, right? Bacterial infection can also occur, can also cause this. So there is the inflammation of the glomerulus of the kidney. So let's move to the next part. So here you can see this hemodialysis. Here is the dialysate. Basically, here you will see, this is to maintain the concentration gradient. These fluids are used to maintain the concentration gradient, right? Right. So you can see this is the filter here. From artery, blood will be taken with the help of vein. It will be passed back. Is that clear? Is that clear? Chali. Done. So the next is the disorders of muscular and the skeletal system. Again, very important topic it is. So disorders of muscular and the skeletal system. So let's talk about that, and let's start with what? Let's start with the myasthenia gravis. So yes, you need to know whether it is autoimmune or what sort of disorder it is. So here also it is an autoimmune disorder. So other than this, right, I'm highlighting it here. The rheumatoid arthritis. Arthritis is having different types now. So rheumatoid arthritis is also what? Rheumatoid arthritis is also an autoimmune disorder. It is also an autoimmune autoimmune disorder. Am I clear? Sure. So autoimmune disorder, Myasthenia gravis, firstly let's talk about that. So it is affecting the neuromuscular junction. Okay, it is basically affecting the neuromuscular junction. So it is an autoimmune disorder. So autoimmune disorders are the one in which you can say our body's immune cells, they are fighting with their own body cells. Like our immune system, which should protect us, it is even fighting with us. This is the basically autoimmune disorder. But yeah, I would like to mention one thing. Do check the Nobel Prize winner for 2025. You will get to know something related to the autoimmune disorders. This is important, right? So do check that out. So basically what is happening here? Here the antibodies, they attack what? They attack the, here in this disorders, the antibodies, they attack acetylcholine receptors, right? You know, it is a neurotransmitter. So that receptors will be attacked by the antibodies here, right? Right, so muscle weakness, that will worsen the activity can occur, okay? Okay. So you know that acetylcholine, just a neuromuscular junction, which is also the motor end plate, right? You know that the nerves, they will, the neurons, they'll pass the signal to the muscles that they need to contract. So they'll release the acetylcholine. So acetylcholine has to bind with the receptors and the process will start. But here these antibodies, they are attacking with these receptors. They will not allow these binding, and obviously the muscle contraction will be affected here. That's how it works. So it can lead to fatigue, weakness, even the paralysis of the skeletal muscles. Any doubt here? Any doubt here? So acetylcholine will not be able to join. If, let's suppose, if this thing will occur in the case of eyes, so ptosis can occur. Do you know that? Ptosis can occur. Ptosis means that eyelids, they'll droop. Okay, so ptosis can also occur if that's the case. Is that clear? So drooping eyelids can occur if eye muscles, right? If eye muscles are affected. Are you getting my point? If eye muscles are affected, then this can occur, okay? Okay? Any doubts? So next is what? Next is the muscular dystrophy. So muscular dystrophy is not an autoimmune disorder, but rather here there is the degeneration of the skeletal muscle, and it is a genetic disorder. What sort of disorder it is? It is a genetic disorder. It is not your autoimmune disorder, rather it is a genetic disorder. So here, why this genetic disorder will occur? Do you know that? Why this genetic disorder will occur? There are different types of this disorder. If there is a mutation in the largest gene, जैसे if there is mutation in dystrophin gene, which is the largest human gene, then this disorder can occur. Okay? Then this disorder can occur if there is the mutation in the dystrophin gene. Okay, so this gene, it makes a protein that will strengthen the muscle cell. So now if it is not there, definitely muscle fibers will break. Okay. Okay, so boys are mostly affected because there is a Duchenne muscle dystrophy. So that is related to the X chromosome. So obviously in that case, the boys will be highly affected. Understood? Boys will be highly affected. So it is X-linked recessive. Okay, it is X-linked recessive. Got that? So next is tetany. It is the rapid spasm, meaning wild contraction in the muscle. So what is it? It is the wild contraction. But I am talking about DMD. This is Duchenne's muscular dystrophy, right, beta? So that is basically recessive, X-linked recessive. Okay. Is that clear? Right? So the one that you are talking, that is, which is even given in our this class 12, that is myotonic dystrophy. Myotonic dystrophy, when you are saying myotonic dystrophy, because these are different, right? So when it is a myotonic dystrophy, then it is the autosomal dominant. But I am talking about Duchenne muscular dystrophy. It is basically X-linked recessive. Okay, it is actually X-linked recessive. So do not get confused here. They are of different types. So this one is, when it is myotonic dystrophy, then it is autosomal dominant. Not even sex-linked dominant, it is autosomal dominant. Understood? Right? Okay, so tetany, rapid spasm, that is wild contraction in the muscle, and it can occur due to the low calcium. So low calcium in the body fluid can be because of any reason. Just for an example, if I'm talking about tetany, so if there is low calcium, let's suppose if there is low PTH hormone, parathyroid hormone, which is also known as collapse hormone. So that hormone is less. Obviously, it maintains the calcium level in the body fluid. So that will also be less. So that's how the tetany occur. Let's suppose if somebody is having vitamin D deficiency, then the calcium absorption is also affected. So there is another thing which is tetanus. Do not confuse these two. Right? Do not confuse these two, tetanus and tetany. Right? I always discuss the difference in these two, right? I always talk about the difference in these two. So tetany may basically what is happening, ultimately there is the low calcium, but it is basically due to the bacterial infection, right? There will be a bacterial toxin in the body. So it is caused by Clostridium tetani. Okay, so bacteria is causing the infection here. Is that clear? A bacteria is causing the infection here. So here you will see the wild contractions, right? You will see the spasms here, wild contraction, and here the rigidity will be felt. Are you getting it? It will be the rigidity here, right? So tetanus, if you remember, it is also referred to as lockjaw. Yes, please. It is also referred to as lockjaw. So here antitoxins and antibiotics are given to treat it. So tetany because of the calcium problem, and tetanus due to the toxin problem. Understood? So that is how they are related, and even that is how they are different as well. So kindly do not make the mistake here. Okay? Done, beta? Sure? So Clostridium tetani, which is a gram-positive bacteria, causes that. So next is gout, inflammation of joints, right? And why? Because there is the accumulation of the uric acid. So gout particularly is the uric acid. And now when it is arthritis, it is the inflammation of joints. And here also inflammation of joints is there, but uric acid is getting accumulated. So this is how you can discuss it. Like let's suppose if I am saying arthritis. So in the case of arthritis, there are different types. You can say gouty arthritis, where I told you clearly that uric acid will get accumulated. Then comes the rheumatoid arthritis, right? Rheumatoid arthritis. In that case, there is an inflammation of synovial membrane. What will be there? There is an inflammation of synovial membrane. You know, na? Synovial joints are the movable joints, right? They are the movable joint. Yes or no? Yes or no? So rheumatoid arthritis, right? So synovial membrane inflammation will be there, right? Joint deformity will occur. So you know that this rheumatoid arthritis, as I told you, it is autoimmune. It is an autoimmune disorder. That is again a PYQ, right? And one is osteoarthritis. So this is related to the aging. This one I told you already, right? Gouty arthritis may basically the uric acid will get accumulated. What will get accumulated? It is the uric acid that will get accumulated in that case. And in the case of your this osteoarthritis, right? So with age, this wear and tear with the age. Moreover, I would say that when there will be the obesity, if there is the overuse of joint, all of it can occur, right? Just say, let's suppose there is the overuse of joints, aging is there, obesity is there, right? So then it will occur. So aging may wear and tear. So that is how we have different types of arthritis. So it is the rheumatoid arthritis, which is basically an autoimmune disorder. Understood? It is actually an autoimmune disorder. Okay. So there are other types also. As of now, just see this only. So osteoporosis, porosis means pores. Osteo word is associated with the bone. So again, it is an age-related disorder where the bone mass will decrease and the fracture chances will increase. So females are highly affected with it. Why? Because after menopause, the estrogen will come down, right? So decrease level of estrogen is the common cause here, right? So please tell me how less estrogen cause this disease. Done. So this is why you know that females, they have osteoporosis. But my point is that why is it so? Like how estrogen is playing the role here. Yes, please. देखो बेटा, this estrogen actually decreases osteoclast activity. Do you know what cells, which cells are they? Like what are they actually? Do you know them? Right, they are the phagocytes. Basically, they are the macrophages. They are the bone-eating cells. In simple words, they are the bone-eating cells. So when we have estrogen in our body, it will stop their, like it will inhibit their activity. Bone destroying cells will be less. They will not be able to destroy the bones. And the osteoblast cells, bone making cells, they will survive more. Moreover, it helps in the maintenance of that calcium balance in the body. So after menopause, when the estrogen will not be there in the body, when less estrogen is there, so in that case, all the things, osteoclast activity will increase, right? So bone eating cells are there, bones will become porous, and obviously the chances of fracture and everything will increase. So now let's So now let's talk about the disorders from the chapter chemical coordination and integration. So overall, it is a very important topic. So make sure you revise everything here. So over secretion of growth hormone, when growth hormones are more, excess of growth hormone, matlab when it comes to the hormones, they should be balanced. If they are less, then also issues will be there. If they are more, then also the issues can occur. So when there is the over secretion of the growth hormone, that will stimulate the abnormal growth of the body. And here the disorder that we are talking is acromegaly, right? Which we have to mainly focus here, right? Mainly which we need to focus. This is very important. Overall, what is happening when there is the over secretion of growth hormone? Who's going to release the growth hormone? GH, which is also known as somatotropin. You know that anterior lobe of pituitary, isn't it? Like when you talk about the anterior lobe of pituitary is the master gland. So there are 6 hormones. So there is a trick here. Go to AC parlor. Let's have facial. Go to AC parlor. Let's have facial. So go to AC parlor from this G, growth hormone, T, thyroid stimulating hormone, ACTH, adrenocorticotropin hormone, parlor. So it is prolactin. Then let's have LH, luteinizing hormone, FSH, follicle stimulating hormone. These two are gonadotropin. Now this growth hormone is also known as somatotropin. So as the name is saying, obviously it will help in what? It will help in the growth. Yes or no? So when it is in excess, gigantism can occur, right? Very tall individual, gigantism can occur. And if it is low, right, then in that case pituitary dwarfism can occur. But sometimes what happens, that excess of secretion of this growth hormone in the adults, especially in the middle age, like let's suppose because of XYZ reason, in the XYZ reason, this growth of pituitary hormone, it increases, then disfigurement in the body can occur. Matlab, jaise, let's suppose the palm, this hand, it will start growing abnormally. Right, the face will start, like it is not even growth of the body. Some parts of the body will start growing excessively. So here you can see excess secretion of growth hormone in adults, especially in middle age, can result in severe disfigurement, especially of the face, called acromegaly, which may lead to serious complications and premature death if left unchecked. Okay. Okay. So it's very hard to diagnose it until changes in external features become noticeable. When these things will be noticeable, now that face is abnormally large, hands are abnormally large, then it will be. Then next is, okay, so next we will talk about the vasopressin. So this is about the anterior lobe of pituitary. Then when you talk about the posterior lobe of pituitary, posterior lobe of pituitary. So when it is anterior lobe, just allow me 1 minute, it's also known as pars distalis. This one is pars nervosa. Done. So it is under the direct neural regulation of hypothalamus. Hypothalamus is the supermaster gland, so it is under the direct neural regulation. It will here it will not pass, the message will not pass through the hypophyseal portal system, rather the direct neural regulation is there. So what will happen, it is the hypothalamic neurons, okay, that hypothalamus or hypothalamic neurons, they form the hormone, they'll give it to the posterior lobe of pituitary to store and to release when required. To store and release when required. So posterior lobe of pituitary is not even considered as a true endocrine gland because it is not making this hormone, right? Because it is not making the hormone, rather it is just releasing it. So two hormones we discuss here, one is oxytocin, the another one is vasopressin, right? One is oxytocin, another one is vasopressin, which is also known as ADH. ADH stands for antidiuretic hormone, right? Antidiuretic hormone. So your oxytocin is also known as milk let down hormone, milk ejection hormone, bonding या फिर love hormone. Okay, so these are the names here. So when you talk about this vasopressin, it helps in regulating the kidney function. Vasopressin, so it is having the constrictory effect on the vessels, you can see that. So what is actually happening, so if you remember RAS mechanism, ADH, you remember antidiuretic hormone. So actually what is diuresis? Diuresis means excess urination, excessive urination. So antidiuretic hormone means the one which will stop it. So if this ADH, right, it conserves the water in the body, it prevents the excess of urination. But if its hyposecretions are there, right, if it is released in less amount, then diabetes insipidus will occur. Do not confuse it with diabetes mellitus. It is the diabetes insipidus. Right, so here what will happen when because hyposecretion of ADH is there, so excessive urination will occur. What will occur, students? Excessive urination will occur, right? The person will be under the constant thirst. Always that person will feel thirsty. So basically we call it as polydipsia. Right, polydipsia will occur. So if excess of urination is there, patient is under the constant thirst, so even the essential nutrients will also pass out. So these are the things which we'll see here. Is that clear? Is that clear? So that's how you have to understand it, right? That's how you have to understand it. Okay, so let's go, let's discuss this part. Just allow me 1 minute. So note down. Okay. Mm, 1 minute. So this is what they have mentioned here, antidiuretic hormone. So if it is less, then what can occur? Diabetes insipidus can occur. Okay, diabetes insipidus can occur. So next disorder is hypothyroidism. So hypothyroidism, as the word itself is saying, right, as the word itself is saying, that basically there is the less secretion of the thyroid hormones. Yes or no? So this is the meaning of hypothyroidism. So basically what is there? There is the less secretion of, yes students, there is the less secretion of the thyroid hormone. So let's see which disorders they can cause. So in the case of thyroidism, you will also see hypothyroidism and we will also see hyperthyroidism. Both the things are there. Hyperthyroidism is also there and even the hypothyroidism is also there. Okay, so firstly here you can see the deficiency of iodine in our diet. If iodine is less, why? Because iodine is required for the formation of this T3 and T4. This is triiodothyronine. T4 is tetraiodothyronine or thyroxine. So if this is less in our diet, right, then what will happen? Hypothyroidism can occur and there is the enlargement of the thyroid gland, which is known as goiter. It is a simple goiter here. What's that? It is the simple goiter here, right? So there is an enlargement in the, yes students, there is an enlargement in the thyroid gland. So this is the simple goiter. Is that clear? This is the simple goiter. Now next to it is basically if there is hypothyroidism, less thyroid during pregnancy, then defective development can occur. This is cretinism. Do not confuse it with the pituitary dwarfism. Here, when a female is pregnant and she is having hypothyroidism, so defective development and maturation of the baby will be there, which will result in the stunted growth. Like the growth will not be proper. Even mental retardation in the case of cretinism will occur. Okay, so mental retardation, low IQ, abnormal skin, even the deaf and the mutism, etc. can occur. Am I clear? Am I clear? Yes. Okay, so simple goiter is the result of hypothyroidism. Even your cretinism is the result of hypothyroidism. But cretinism, when the female is pregnant and her baby will show the stunted growth, mental retardation, low IQ, etc., etc. So in adult women, hypothyroidism may cause menstrual cycle to become irregular as well. So when female is having irregular periods, doctors always suggest to get the thyroid test, right? So even this is what we need to understand. So when somebody is having hypothyroidism, na, they'll become fluffy, right? In the case of, because it also affects our thyroid secretions, they also affect our BMR, basal metabolic rate. So if its secretion is less, BMR will be affected. So in that case, the fluffiness will be there in the body. The fluffiness will be seen in the body. Are you getting my point? Right? So like that person will feel fluffy. It feels like that you have gained a lot of weight. Why? Because BMR is also slow. Next is due to the cancer of the thyroid gland or due to the development of the nodules of the thyroid gland. If there is the cancer of the thyroid gland, right, or if there is the development of the nodules of the thyroid gland, the rate of synthesis and secretion of thyroid hormone is increased to the abnormally high levels and hyperthyroidism can occur. Is that clear? Is that clear? So one more thing is exophthalmic goiter, which is again a form of hyperthyroidism. It is important. So simple goiter, again I'm specifying this thing, it is the result of hypothyroidism. It is the right hyperthyroidism, exophthalmic goiter, in which eyeballs, it will feel like that they are just too protruding. So here enlargement of thyroid gland, protrusion of the eyeball, increased BMR will be there. That person will be very lean and weight loss will occur. So it is also the Graves' disease. Got it? It is also the Graves' disease. Done? Sure. So these disorders are very important. So now let's move to the disorders of the adrenal gland. Okay. So Graves' disease is also an autoimmune disorder. You can just mark it. It is also an autoimmune disorder. So next is the adrenal gland and the disorder associated with it. Okay. So let's discuss that. So here you can see, we know that it is the cap of kidney, this adrenal gland. It is the cap of kidney. So it is having the adrenal medulla, right? And outermost is the cortex. So when we talk about the adrenal cortex, here we have 3 layers. For that, GFR is the trick. Guffer is the trick. So zona glomerulosa, which is the outermost layer. Zona fasciculata, right? That is the middle layer. And then there is zona reticularis, which is the innermost layer. And this medulla, it releases the hormones made up of amino acid. They are also known as catecholamines, right? So they are basically epinephrine or norepinephrine. Remember, epinephrine or norepinephrine, which is adrenaline or noradrenaline. So zona glomerulosa, fasciculata, zona reticularis is there, right? So these are the layers. So they will release the corticoids. Just cortex will release the cortisol. If I have to write it here, just cortisol, right? Your even the androgens, aldosterone, even corticol, cortisones, and the androgens are also released by this. Okay, so when you talk about the symptoms, so one is the Cushing syndrome, right? Here Addison is given only, but one more is there, that is the Cushing's syndrome, right? One is what? It is the Cushing syndrome, adrenal gland disorders. What's that, students? So it is the Cushing's syndrome. Are you getting my point? So here what is happening in the case of Cushing syndrome, when there is the excess of cortisol, right? So it's the excess of cortisol that will cause it. That will cause it. Excess of cortisol. So who's going to release the cortisol? It is the adrenal cortex. It is the adrenal cortex. So moon phase will be there, right? Because cortisol is more. And to treat it, basically the so excess cortisol is there. So it can, how can it occur? Like might be there is adrenal tumor, and moreover, let's suppose if a person is on steroid therapy, if somebody is taking excess of steroid, they might get affected with this particular disease. So Cushing syndrome it is. So it's like key central obesity will be there, high blood sugar, right? Central obesity, high blood sugar, kind of moon phase. So that type of things will occur here, right? Yes, please. Yes, please. So there is one more which is even given in your NCERT Addison's disorder, Addison disease, Addison disorder. So here there is less cortisol or less aldosterone. So if it is less, so here there will be, right, what will be, you see that excess of excessive, because cortisol is less, aldosterone is less. So in that case, you will see even the blood pressure is going to be low. You'll see the skin color will change, right? Skin color will change. It's kind of bronze skin. This appearance will be there, right? So it is the Addison's syndrome, yeah, Addison disorder, disease rather, right? Right? So blood pressure will be less, skin color will change. So you will, that will be the bronze skin. So it is due to the hyperpigmentation. It is the hyperpigmentation. And in that case, even fatigue, that person will feel fatigue, and the weight loss will also be there. Okay, so it is due to low cortisol या फिर low aldosterone. Okay, there are other disorders also, but we'll discuss this. Chaliye, so here you have Addison's disease. So when there is the underproduction of the hormones by adrenal cortex. So if at the place of adrenal cortex, even if I will mention medulla, then it will be incorrect, because Addison's disease will only occur when there is the hyposecretion of the hormones of what? Adrenal cortex. Is that clear? So carbohydrate metabolism will be altered. So as I said, the weakness, fatigue, and all will occur. Done? Chaliye. So let's start the next part, right? Diabetes mellitus, and then we will talk about the class 12th disorder. 1 minute. So next is the diabetes mellitus. So diabetes mellitus may, it's a PYQ as well. So ketonuria and glucoseuria will be there. Right, so what is happening in this particular case? So due to the prolonged hyperglycemia, excess of sugar will cause this diabetes mellitus. So loss of glucose through urine and the formation of harmful compound, which are the ketone bodies, water soluble. So basically, when let's say the body is starving, in that case also these ketone bodies they form. Is that clear? So diabetes mellitus is different, right? And the diabetes insipidus is different. Please do not confuse it. Is that clear? So mellitus mane honey, mane when there is excess of blood sugar, it can cause that. Understood? It can cause that. Okay, so it is the high blood glucose. So it either can be due to the deficiency or resistance of insulin. Okay, so on the basis of that, you have type 1 or type 2 diabetes. So when I say type 1 or type 2, so it is because of insulin dependent. It is insulin dependent, right? And this one is insulin independent. So basically in this case, you will see that insulin production is not sufficient. Okay, okay. So type 1 diabetes mellitus is also there. Type 2 diabetes mellitus is there. So here in type 1, insulin production is not there, right? So it can occur. So it is also the, sometimes it is also the autoimmune destruction of beta cells of pancreas. So autoimmune destruction of beta cells means, you know that beta cells, they release the insulin. So because of that, autoimmune destruction is there. So insulin will not form. So insulin therapies are required. And in this case, the insulin resistance is there. So basically here in this case, you will see that the cells, they are not responding to the insulin. So it is the diabetes mellitus. Understood? It is the diabetes mellitus. Okay? Understood? So in diabetes insipidus, there is a hyposecretion of the diabetes, hyposecretion of the PDH, okay? Right? So either it can be glucoseuria or glycosuria, it's one and the same thing. So urine is there, the glucose, it means glucose in urine. Chaliye, next. So next is from human health and disease. So Salmonella typhi, right? Salmonella typhi. This is the thing. This is the bacteria. So it causes what? It causes typhoid, right? Salmonella typhi, it is a bacteria that will do what? That will cause the typhoid. Is that clear? So it is Salmonella typhi. So it, so typhoid, which is also known as enteric fever, typhoid, which is also known as enteric fever. So these pathogens generally they enter the small intestine through food and water contaminated with them. Is that clear? Through food and water contaminated with them and migrate to other organs through blood. So high fever, weakness will be there, stomach pain, constipation, headache, loss of appetite will also occur. So how can this be confirmed? So this typhoid is confirmed by Vidal test. Right? How can it be confirmed? Vidal test. And here we also discuss about the typhoid Mary Mallon, which is cook by profession. She was the carrier, right? And she spread the infection. Okay? Okay, so typhoid, the confirmatory test is very important. Done? Done, beta? So any doubts here? Please read it quickly. Okay. Chali. So if it is the paratyphoid, right? Paratyphoid is also there. This is typhoid, so paratyphoid is also there. So that is caused by Salmonella paratyphi, right? That is also called by Salmonella paratyphi. So in this case, the blood test is done. Blood culture rather is done. So next is the Streptococcus pneumoniae, right? And Haemophilus influenzae. Streptococcus pneumoniae, Haemophilus influenzae. So it causes the disease pneumonia. So pneumonia affect the lungs. Common cold, which is a viral disease, it just affects the respiratory passage, but it is the pneumonia here which will affect what? Which is going to affect your lungs as well. So here you people can see Streptococcus pneumonia and Haemophilus influenzae. They are basically responsible for the disease pneumonia in humans. So it infects the alveoli. So alveoli, which is the primary site for exchange of gases, that will be affected here. So if you know that if alveoli they are affected, then obviously the gaseous exchange will be affected, and accordingly the body organs, they'll be deprived of that oxygen as well. So as the result of the infection, the alveoli get filled with fluid, leading to severe problems in respiration. So symptoms of pneumonia, they include what? They include the fever, chills, cough, headache, and in severe cases, the lips and the fingernails may turn grey to bluish in color. So a healthy person acquires the infection by inhaling the droplets or aerosols resulted by an infected person, or even by sharing glass and utensils with an infected person. Understood? Done? Sure? So here this dysentery is mentioned. So dysentery, it is because it is bacterial dysentery. So Shigella species causes that. It is the bacillar dysentery. It is also known as shigellosis. So next is your plague. It is caused by bacteria Yersinia pestis, right? So plague, which is also known as Black Death, right? So its agent here is a flea, the vector rather. Vector here is the flea, that is Xenosylla chiopsis. But the bacteria is Yersinia pestis. And diphtheria is caused by Corynebacterium diphtheriae. Diphtheria is caused by Corynebacterium diphtheriae. So this is also the thing that you have to remember. So next is the many viruses, they also cause disease in human being. So we have the rhinovirus. What do we have? We have the rhinovirus. So rhinovirus represent one such group of viruses which cause one of the most infectious human ailments, that is the common cold. So they infect the nose as well as the respiratory passage, but not the lungs. So once there was a MCQ from this particular part, okay, there was a MCQ from this particular part, that how this common cold and this pneumonia is related. So they are obviously not. Pneumonia is caused by bacteria, common cold is caused by virus, and moreover in the case of pneumonia, lungs are affected. The fluid will be accumulated in the lungs, but in the case of common cold, only the nose and the respiratory passage is affected. Nasal congestion, discharge, sore throat, hoarseness, cough, headache, tiredness, etc. will there. Okay. So next disorder that we have is malaria. So we know that it is caused by a protozoan. So Plasmodium species, they cause it. Yes, please. Plasmodium species. So common one is Plasmodium vivax, and the most dangerous is caused by Plasmodium falciparum. Is that clear? So other than that, we have other species also, just if Plasmodium ovale is there, Plasmodium malariae is there. Is that clear? So in this case, okay, so in this case, you will see that the female Anopheles mosquito, right? Female Anopheles mosquito is actually the vector. It is actually the vector. And here, female Anopheles is not the parasite, it is the vector. It feeds on the human blood for the egg production. It is not feeding on it just for the food. Is that So here what will happen, female Anopheles mosquito when will bite the human will inject the sporozoids. So sporozoids, that's what you have to remember. Sporozoids, it is the infective stage, right? So these sporozoids, beta, they will just move in our blood for around 30 minutes and then finally they will enter in the liver. So in the liver, what actually will happen, it will be the pre-erythrocytic, right? Pre-erythrocytic division will be there. Firstly, in the human body, remember, female Anopheles, that is the primary host here. Why? Because the sexual stages of this parasite is in the case of the female Anopheles mosquito. Human is the secondary host here, and human is the one which will get infected. So in the case of human, only the asexual reproduction will occur. In the case of mosquito, the sexual stages of this parasite will be there in the mosquito's case. That's why it is the primary host, number one. Now, here in this case, what you have to remember, right, that asexual division, that is the multiple fission and all will occur in the case of humans. So basically, in the case of the life cycle of this particular parasite, firstly, in the liver, it will divide, right? It will divide, the sporozoid will enter, it will show the multiple fission, they will increase their number, and then, right, from the liver, they'll start infecting the RBCs, right? Right, so it is the pre-erythrocytic, means before erythrocyte. So it is the pre-erythrocytic schizogony. So it is the example of what? Asexual reproduction only. So this one will be the erythrocytic schizogony here, right? So in this case, what will happen? In this case, what will happen? They'll start feeding on the RBC. They start infecting the RBCs, right? They will start feeding on the RBCs, right, beta? Right? Yes, please. So that is how it works. Okay, so it will, in the RBCs also, these sporozoids, rather the merozoids, they will start feeding on that hemoglobin as well. So they'll start rupturing the RBC, and when there is the release of the hemozoin is the toxin. So when the hemozoin is released in the blood, then the person will have fever, then the person will have chills, and the symptoms will appear. So by the time this pathogen enters the body and the first symptom appear, this is known as the incubation period, right? Incubation period, right? Done, beta? Okay. Is that clear? So that is how it works. Now, what happens is that in some RBCs, right, in some RBCs, these merozoids, they don't rupture them. Yeah, these sporozoids, they do not rupture them. They start growing, right? They start growing and they start making the gametocyte. We know that gametocytes are the cells which will form the gamete. But actually, human body, the temperature, the conditions in the human body, they do not support the growth of the gametes of this particular pathogen here. So the large gametocyte is the megagametocyte that will make the female gamete, and the smaller one is the microgametocyte. Smaller one is the microgametocyte that will make the female gamete. So they will not further develop here, right? They need the mosquito host basically. So if, let's suppose, if a person is getting infected with the malaria, right, and that any mosquito when sucks the blood of that person, these gametocytes with that blood, they will enter into the mosquito's body. So basically in the mosquito's gut, from these gametocytes, gamete will form, right? The larger gamete is the female gamete and smaller is the male gamete. The gamete fusion will occur. There is the formation of ookinete, right? Ookinete, which is also known as vermicule. So here in the case of this malarial parasite Plasmodium, so this is what you have to remember, that in this case the zygote is motile. Actually the zygote is ookinete, right? It is the vermicule. It is the motile zygote. So it will pass, it will find its way, it will enter in the gut wall here, will become circular beta, right? And then it is, you will call it as oocyst. Further the division will occur, so many sporozoids will form and they will pass to the salivary glands of that mosquito. So that's how, this is what the life cycle of this malarial parasite is. Any doubts here? Yes, please. This is the life cycle of this malarial parasite. Any doubts here? So question will come, which one is the infective stage? It is the sporozoid. When the fever will be there? When the fever will be there, right? When there is the release of hemozoin actually. Done, beta? Sure. So that is how it works. Okay, so let's move to this part. Let's read it from here only. So yes, it is the falciparum which will cause the most dangerous type of malaria. It is also referred to as the malignant malaria, and rest I have explained everything to you here. Understood? Chaliye, next move to the next part. So entamoeba histolytica, it causes amoebiasis. It is the amoebic dysentery. Students, bacterial dysentery is caused by, right, bacterial dysentery. Do check in the paper what do they ask. This is also known as shigellosis. But if it is the amoebiasis or the amoebic dysentery, then you are talking about the entamoeba histolytica. Where is it living? It is living in the large intestine of the human. So this one is actually monogenetic. That is, it is having the single host. Right, what does it contain? It is having the single host. Here you will see there is a tetranucleate, like 4 nuclei are there, tetranucleate cyst. It is the infective stage, right? So these cysts, they'll pass from the stool of the infected person when they will enter in the surrounding through the contaminated food and water. We can have it, right, beta? We can have it through contaminated food and water. We can have it, and this tetranucleated cyst is the infective stage here, right? So where do you see this? It is in the large intestine of the human. So because it is dysentery, the symptoms are generally same: constipation, abdominal pain, cramps, stools with excess mucus, and blood clots will be there. So houseflies, they are the mechanical carriers here, right? They spread the parasite actually. They spread the parasite actually. Next is the Ascaris, which is the roundworm. Which is the roundworm. It causes ascariasis, right, students? So here you know that we see the sexual dimorphism, and this one is also, Hanji, here also you will see that in the case of Ascaris, right, it is the intestinal parasite. It lives in the intestine. Is that clear? So internal bleeding, muscular pain, anemia, fever, blockage of the intestinal passage, all that things will occur. So the eggs of the parasite, they'll excreted along with the feces of what? Feces of the infected person. Is that clear? Done? Yes, please. Done, beta? So another worm which is mentioned here is Wicheria. So it is having 2 species which we need to keep in our mind: Wicheria wencrofti and Wicheria malai is there. Done. So beta, this one, it is also known as the filarial worm, right? It is referred to as viviparous, but rather like viviparous, you know na, which give birth to young one. Rather it is ovoviviparous, because basically what is happening, that eggs, they'll hatch in the body itself, right? But there is no placental connection the way we have. Okay, right? So this one basically causes what? It causes the filariasis, which is also known as elephantiasis. Okay, so it will cause the blockage of the lymph vessels, right? Swelling will be there. And here, female Culex mosquito spread it. That's the vector here. So this is the information that you need to remember, okay? This is the information that you need to remember. Understood? Sure? Okay. So vector is the Culex mosquito. So this one is most common in India. Next is, this one I have already explained, which area when Crofty and Malai, filarial worm, slowly developing inflammation of the organs in which they live for many years. So they block the lymphatic vessels, right beta, they block the lymphatic vessels of the lower limb, and sometimes it can even affect the genitals as well. So elephantiasis or filariasis is the disease name. So genital organs are also often affected. So gross, that is superficial deformities will be there in this case. So pathogens are transmitted to a healthy person through the bite by the female mosquito vectors. Is that clear? Sure. So next part is what? Next is many fungi belonging to the genera Microsporum. So if at the place of Microsporum they mention Macrosporum, then it's a mistake. So Trichophyton and Epidermophyton, they are responsible for the ringworms. They are responsible for what? They are responsible for the ringworms. Is that clear? Yes, please. Is that clear? So here what is happening, dry scaly lesions on the various parts of the body will occur. It can be skin, nails, and even the scalp, right? So these lesions are accompanied by the itching, heat and moisture. You know that it helps the fungi to grow. So sometimes you know that they are in the skin folds, such as those in groins or between the toes. So ringworms are generally acquired from soil or by using towels, clothes, or even the comb of the infected person. Got it? Right? Sure? Okay. So in the paper, once there was the question, it is athlete's foot. It is also known as tinea pedis. So this is actually a fungus infection. So it is mainly caused by Trichophyton species. Mainly it is the Trichophyton species, but yes, some Epidermophyton species can also cause it. So this is what you have to remember here. Is that clear? Right? Tinea pedis, Trichophyton species, but yes, it can also be caused by the Epidermophyton. Okay? Done? Let's move to the next part here. So allergy, you know that is the exaggerated immune response. So allergy is caused by what? Allergy is caused by allergens. It is caused by what? It is caused by allergens. So when a person is having allergy, right, the IgE, allergy, this antibody is present in our body in excessively, right? So when immune system, when our body organs, they are reacting against an organ, right, they are giving an exaggerated response, that is an allergen. Okay, so IgE type, this is your PYQ. Do remember this. So dust, mites, pollen grains. Some people are even allergic to peanuts. They are allergic to some sort of scents as well, right, students? So in the allergic reaction, sneezing, watery eyes, running nose, difficulty is there. Okay, so how this allergy is caused? Because the cells in our body, they'll release the histamine, they'll release the serotonin, right, from the mast cells. So mast cells, they release this. Histamine is a vasodilator, serotonin is a vasoconstrictor, right? So if we have to check which one is the allergen, so patient has to give the specific doses of small doses of that allergen so that reactions can be studied. So because during the allergy, histamines and serotonins are released, so to treat them, antihistamines, right, even the adrenaline and the steroids are given for quickly reducing the symptoms. Okay, right? So if there is excessive allergy, then it is the anaphylactic shock. That is referred to as anaphylactic shock. If it is not treated properly, it can result in the death of that individual as well. Is that clear? Done, beta? So it's a life-threatening hypersensitivity to something. Okay, so autoimmune disorder, I already told you here, body is fighting with its own body cells. So rheumatoid arthritis is the example, right? Even that your exophthalmic goiter, in that case also it can occur. In diabetes mellitus case, sometimes there is the autoimmune destruction of the beta cells as well. So that is how you have to remember it. Any doubts? Any doubts? Sure. Any doubts? So next is the AIDS. So AIDS stands for acquired immunodeficiency syndrome. It's the secondary immunodeficiency disorder. Why secondary? Because it is acquired during the lifetime, right? It is not by birth. Who's going to cause that? HIV, human immunodeficiency virus, right? It is a retrovirus where RNA is the genetic material. And let me tell you that here, the Western blotting, as per the PYQ and everything, it is the confirmatory test. Western blotting is the confirmatory test for this, right? ELISA is also conducted, but when it comes to the confirmation, Western blotting is done. Is that clear? So here the immune system will become weak, right? Basically, why? Because when the virus will enter in the body, see, first of all, it is the acquired immunodeficiency syndrome. So syndrome is what? Syndrome means group of symptoms it is, right? So many symptoms are there. So it was first reported in 1981, and in the last 25 years or so, it has spread all over the world, right? So it is caused by HIV, human immunodeficiency virus. So this is a question in the AIMS that which one is the infection, which one is the pathogen. So HIV is the pathogen, AIDS is the infection here, right, students? So it is having the RNA genome. So transmission can occur by, from this part also PYQs are there, sexual contact with the infected person. If there is any exchange of the body fluid, it can occur by the transfusion of contaminated blood and blood product, by sharing infected needles, and even let's suppose if drug abusers are there, they are sharing the intravenous, they are basically sharing that syringe, the injection, they can also get it, right? And even it can pass from the infected mother to her child through the placenta, right? So those individuals who are having, you know, multiple sexual partners, they are not using the condoms, right? They are having the unprotected sexual intercourse with multiple partners, drug addicts, those who are taking drug intravenously, right? And the individuals who are undergoing repeated blood transfusion, and the children born to the infected mother are highly affected. Is that clear? Is that clear? Yes, please. So now, basically what is happening? HIV virus, as I said, it is a RNA virus. So in this case, you will see what? Just I'll make a rough diagram here. Just let's suppose. So first of all, we know that there will be the enzymes present in it. We know it very well. So single-stranded, two single-stranded RNAs will be there, right, students? So we will see the enzymes. There are other enzymes also. We will see the enzyme reverse transcriptase here, which will help in reverse transcriptation. So from this RNA, the DNA will form. We know that how the viruses, they act. They enter the host cell, they hijack the host machinery, they use the host machinery and the enzymes to make their own DNA. So this is what this HIV virus is going to do. First of all, remember that here, this is the protein coat that is covering it. We are calling it as capsid. So capsid is the protein coat that protects the genetic material here. So capsid itself is made up of what? Capsid itself is made up of monomers, which we call as capsomeres. So capsomeres, they together, capsomeres are the monomers. They together form what? They form the capsid. So outside there is what? Outside there is the lipid envelope, and other than that lipid envelope, what else do you see? You see here the transmembrane proteins, docking proteins as well. So obviously they are the glycoproteins which are present on this lipid envelope. So it is an enveloped virus. Are you getting my point? Are you getting my point? So here you will see, yes, please. Right here you will see that this lipid envelope is having GP120 receptors, glycoprotein 120 and glycoprotein 41 as well. Do you know about it? Right, if you watch my lecture, then I'm sure you know about it. So basically GP120 and GP41, they are present here. So this one is the transmembrane protein. This one is the docking protein. It will docking protein. Right, this GP120 actually, right? Please mark this. This GP120, it is basically the, one second, guys. Okay, so this is the docking protein, or I would say this is the surface protein. This is the surface protein rather. So here what will you see? Here what will you see? It is having, its receptors are on, basically it will bind with CD4 receptors, right? CD4 receptors. So these CD4 receptors, where do you see that CD4 receptors? You will see them on the T helper cells as well, right? On the T helper cells you will find them. So this will help that to enter in that cell, and GP41, they will help virus to get fused with the host cell, right? To get fused with the host cell. So that is how a virus has to enter into the host body, host cell first, and then it has to hijack the host machinery, and then done, and then they will enter. Yes, please. Then they will enter in the host cell, they will use their machinery and then act accordingly. So with the help of it, you can understand that. So retrovirus, viral RNA core, virus will infect the normal cell. How? It is having the surface protein which will bind to that, the receptors present on the animal cell. So virus RNA is introduced into the cell. It will produce its DNA with the help of reverse transcriptase enzyme. Viral DNA will get incorporated into the host genome. It is having enzymes to do that as well. So new viral RNA is produced by the infected cell. New viruses are produced. So beta, new viruses, they can infect the other cells as well. So here what exactly is happening in the case of AIDS? AIDS may, it's not like if somebody is HIV positive, that person will immediately get AIDS. No, HIV positive doesn't mean AIDS. AIDS is the group of symptoms. So when the immune system will be weak, then this syndrome will arise. Okay, so its incubation period is few months to many years, that is 5 to 10 years. So what is going to happen here? Virus will enter into the macrophages, right? Yes, CD4 receptors are also there. So RNA genome of the virus replicate to form viral DNA with the help of reverse transcriptase. Then you know that they will use the host cell to make multiple copies. So these macrophages, which were supposed to protect us, they continue to produce the HIV virus, and they will behave like the HIV factory. So these macrophages, which are our immune cells, which are supposed to protect us, they are rather protecting us. They will act like what? They will act like the virus factory. Then after that, these HIV, they will enter in the helper T cell. You know that this is the helper T cell, right? It is the helper T cell. You know it very well. That is basically a kind of mediator for the CMIS as well as the AMIS. Like helper T cell will also stimulate the antibody mediated immune system. But if that cells will not be there in our body, then what will occur, students? What will occur? The progeny virus, they will be released into the blood. They will attack other helper T lymphocytes. So this is repeated, leading to the decrease in the number of the helper T lymphocytes in the body. So during this period, the person suffers from the bouts of fever, diarrhea, weight loss, and due to the decrease in the number of helper T lymphocyte, the person starts suffering from the infection that could have been otherwise overcome, such as those due to the bacteria, especially mycobacteria, viruses, fungi. So because immune system is not working, so they also, right here, mycobacterium, viruses, fungi, even the toxoplasma, they will also start affecting that body. Why? Because immune system is not working. So for these viruses, for these pathogens, for these fungus, that body is just like a club where they can just have party, right? Why? Because immune system is not working there, right? So widely used diagnostic test is enzyme-linked immunosorbent assay, but the confirmatory test is the Western blotting, and here you will see antiretroviral drugs are given, right? Just say AZT is so Zydoruvidin, AZT is given. Zydoruvidin, I have to check the spelling, I'm unable to recall it now. So this is given. So here you cannot say that death of that person can be avoided. No, but it's just that their lifespan can be prolonged. Is that clear? Their lifespan can be prolonged. Is that clear? Done, student? Done, students? So this is what you have to remember. So next is what? Next is the cancer. Next is the cancer, but before that, they say AIDS has no cure, prevention is the best option, right? So it spread due to the conscious behavior pattern and not something like pneumonia or typhoid. So infection in the blood a transfusion patient, newborn from mother, right, they will get the infection. The only excuse may be ignorance, and it has been rightly said, don't die of ignorance, right? So in our country, NECO, National AIDS Control Organization, so sometimes they do ask the questions on the basis of such full forms as well. So, and other non-governmental organizations, they're doing a lot to educate people about AIDS. So WHO has started a number of programs to prevent the spreading of HIV infection. So making blood safe from HIV, ensuring the use of only disposable needles, syringes in the public and private hospitals and clinics, free distribution of condoms, controlling drug abuse, advocating safe sex, and promoting regular checkups can help that person. Right, students? Okay. Yes, please. Done. So this is it. So next is basically what? Next is basically the cancer. Okay. Done, beta? Chaliye, so this is AZT, it is actually zidobutene, right? Beta, it is actually this kind of drugs they are given, they are actually the inhibitors of the reverse transcriptase enzyme. Understood? They are actually the inhibitors of the reverse transcriptase enzyme. Right? So this AZT stands for, this is basically the AZTT stands for the azithymidine. Okay? This is actually the azidotymidine it is. So next is the cancer, which is the abnormal, right? So here I will explain the most important terms to you. So next is the cancer, beta. So cancer is the most dreaded disease of human beings. It is a major cause of the death all over the globe. So more than millions of Indians, they suffer from it. So we know that it is the abnormal cell growth. In our body, students, this can occur due to mutation. Many reasons are there. We know that genetic and all mutations, they can cause it. Study of cancer is known as oncology, right? Study of cancer is known as oncology. Genes that cause cancer are known as oncogenes. This is important, right? Oncology is what? It is the study of cancer. So now here I'll teach you one thing, that just say I'll give you the example of proto-oncogenes. We know that this cancer occurred due to the mutations. There are two types of mutations that we have. One is the loss of function mutation that can cause cancer. One is the gain of function mutation. One is the gain of function mutation. So loss of function mutation, just say for an example, we have P53 gene. It is actually a tumor suppressor gene. I'm giving you one example here. It is actually the tumor suppressor gene. Its role is what? To suppress the tumor. Let's suppose if it doesn't work, right? If because of mutation, if it is not working, means loss of function mutation. If it is not working, it can cause the cancer. Now gain of function mutation, just say these proto-oncogenes. We need their function. Normally they work in our body, right? Right? Yes, beta, you have to remember it. So proto-oncogenes, normally we need their role, their protein in our body. But if they will start making their product in excess, then it can cause the cancer. Let's suppose because of the mutation, they excessively make their product. Because of the mutation, if they excessively make their product, then what will happen, students? What will happen in that case? That can also cause the cancer. So yes, we have certain genes in our body which are not cancerous. We need their protein normally. But if they will gain mutation, if they will start making their protein or the product excessively, we can get cancer. So this is the thing, right? So millions of Indians, they are suffering from it, right? So mechanism that underlying development of cancer or oncogenic transformation of cell, its treatment and control have been some intense area of research, right? So we know that in our body, when it comes to the growth and differentiation, right? Cell growth and differentiation is a controlled and a regulated process, right, students? Right? So, but in the case of cancer cells, because body's regulatory mechanism is not working. In our body, in our cell cycle also, we know that checkpoints are there. So when there is the cancer, that checkpoints will not work. Normal cells, they show the property of contact inhibition. Like if they are growing excessively, other cell will be like, no, you just grow up to that part only, no need to grow excessively. But here in this case, we will see that there will be no contact inhibition in the case of cancerous cell students. They have lost this property, right? So they will make the uncontrolled cell growth, uncontrolled cell mass will be there. Even these cancerous cells, they don't need any special growth factors for their growth and all. You know, these cancerous cells, they perform angiogenesis. Angiogenesis means they start making the new blood vessels. They start making the new blood vessel, they will get more blood, other organs will be deprived of that. That's how they kill us as well. So when this cancer tissue, when this abnormal tissue, when it is accumulated at a place, when it is localized, right? When it is localized, you see, cancerous cells just continue to divide, they will form the cell masses, we are calling them as tumor. So if it is benign, benign means localized it is confined to their original position, they are not going to any another area, they are not spreading, right? So they will cause the little damage. By a surgery, we can remove it. That's how it works. But when it comes to the malignant tumor, from LM, you have to remember movable, you have to remember metastasis. So what is this metastasis, guys? So metastasis means they will invade the surrounding tissue. They will not be localized to one place. They will go here and there, and they will invade the surrounding, right? So here, the malignant tumors, they are the mass of proliferating cells. We are also calling them as neoplastic or tumor cells. They grow very rapidly. They invade and damage the surrounding, right? They grow, divide, they move to the new areas. So cells slowed from such tumors, they reach distinct sites. Is that clear? So this is metastasis, most feared property because we cannot control them. So carcinogens, they cause the cancer. This can be physical, chemical or biological agents that can cause it, students. So ionizing radiation like X-rays, gamma rays. So in the paper, they can ask you this question, which one is ionizing, which one is non-ionizing. Ionizing radiation like X-rays and gamma rays can cause it. Non-ionizing radiation, UV rays, can also cause the DNA damage. Just UV radiations, do you know that they form thymine dimers in the DNA? That's how they damage the DNA structure. Is that clear? Right? So leading to this cancerous transformation, right? So tobacco smoke, yes, जैसे benzopyrene is present, that is also cancerous, right? Nicotine is addictive. Nicotine is not cancerous, but yeah, benzopyrene present in this tobacco smoke can cause the cancer. So oncogenic viruses are also there, right, students? So already told you about the proto-oncogenes that normally we need their function, but when they will do that in excess, it can result in what? It can result in the cancer. Then baki early detection is essential, beta. If it will be detected early, then it can be cured. So biopsy and, right, biopsy and histopathology studies help in that. Blood and bone marrow tests for the increased cell count in the case of leukemia, that is a blood cancer. Jaise carcinoma, most common cancer, cancer of the epithelial tissue. Leukemia, cancer of the blood tissue. So biopsy mein a piece of the suspected tissue will be cut into sections, stained, examined, beta. So radiography, CT scan. CT is basically computed tomography, MRI, magnetic resonance imaging. So they are useful to detect the cancer of the internal organ. Is that clear? So CT will help in uses X-rays to generate the 3D images, and MRI use strong magnetic fields and non-ionizing radiation to detect these pathological and physiological changes. Is that clear? So antibodies against cancer-specific antigens are also used for the detection of certain cancers. Is that clear? Is that clear? Done? So baki treatment mein beta, we know that common approaches are surgery, radiation therapy, immunotherapy. So in radiotherapy, tumor cells are irradiated lethally, taking proper care of the normal tissue and surrounding the tumor mass. Several chemotherapeutic drugs are to kill the cancerous cells, right, students? So majority of drugs have side effects also. Hair loss, anemia, and cancer can also reoccur. We know it very well. So tumor cells have been shown to avoid detection and destruction by immune system. So the patients are given substances called biological response modifier like alpha interferons, which activate their immune system and help in destroying the tumor. So this is all about today's class. This chromosomal disorders, I'll put a recorded video for that. So this is all about today. I hope you guys enjoyed the lecture. So I'll keep posting such right? I'll keep posting such short lectures, short videos as well, for not just for the disorders, for other topics as well. Ma'am, is anemia a symptom of cancer? Beta, not always. Sometimes your poor diet can also be the reason, but if let's suppose diet is proper, everything is fine, then it might be. So obviously proper test can diagnose it. Okay.